So can implants be used and avoid a lift? The answer is really no. Implants do a certain job and lift does a different job. Now, in certain people with specific anatomy and certain goals, implants may be able to be used and avoid a lift. That tends to be more in people who we would consider borderline lift and people who also want a more natural result. See, the implants will always end up settling into where most of the breast tissue is. So if someone has a lot of lower positioned breast tissue, that's where the implants are going to settle, and a lift would help give a more perky, more augmented look. If someone doesn't have a lot of lower breast tissue and nipple position isn't very low, especially if they end up wanting a little bit of a larger implant, we may be able to get by without a lift and still give a result that you're going to be happy with. Now, that's something that at your consultation, after we do an exam and your Vectra, I'll be able to show you what a lift looks like, what it would look like without a lift, and then together decide if it's best to just do implants or if implants with a lift is the right procedure for you.